Jay Pendleton, MedTech Voice. Welcome to 5 Good Minutes with Dr. Christopher Yeung.
Hey Jay, how you doing?
Great to see you. Wanted to talk about your experience, orthopedic surgery. You've seen a lot. There's an endoscopic spine. It's part of your practice, big part of your
Yeah,
practice.
no, absolutely. I was kind of born into it. My dad was a pioneer in endoscopic spine surgery. He took a lot of arrows in his back, and it's awesome to be here at ESMIS.
Yes.
And endoscopic spine surgery is a big part of the program. So it used to be just my dad up there talking, and they're like, hey, who's this crazy guy doing an endoscope in the spine and stuff? And now it's like the hottest topic in spine. And we have programs dedicated to it. There's societies dedicated to it now. A lot of surgeons are adopting it, and it's just really exciting to see that change and shifting in the tides.
Why do you think it's taken a while for the U.S. market to adopt what other continents?
Oh my gosh, so many reasons. One, it's sort of supplanting probably the best and most successful surgery most surgeons do. Minimally invasive, like discectomy, tubular discectomy, microscopic. That's an outpatient procedure.
Right.
Patients do very well. So it's hard to beat that, but endoscopic surgery is just another way to do it, and it's actually even a lot less invasive. There's just a lot of factors.
Right.
That's the funnest, easiest case for people to do already, and so there's also not that much monetary incentive. It's really more for the patient.
That's right.
The benefits mainly for the patient because they're all outpatient procedures.
Where do your patients go to find information? I'm fascinated by this topic.
Oh,
I'd love
gosh.
your perspective, because I think that there's a void there.
I still think, in my practice, and I've been in practice over 20 years, the best, I guess, referral base is my own patients. And so, they have good results. They're telling all their patients or all their friends and family and stuff. And just, I think that word of mouth locally is where I get the most of my patients. It's just an extension, more amplified of your local reputation.
That's right.
But it's just permanently on the internet, right?
That's
so, yeah, I think patients, number one. Two is just information out there when people are researching and they're asking other patients, other doctors who they'd refer, and a lot of people come to me and say, yep, I asked all these people, and say I asked like 4 people, and they gave me 2 to 3 names, and your name was one of the 3 all the time. So
awesome.
I'm coming to see you. So that's still
Word of mouth is
word of mouth, yeah.
still key. What do you see? What are you maybe hoping to learn at the fall conferences that you're attending? What are you maybe hoping to provide to the market at some of these shows? I mean, you're teaching, you're doing a lot of things.
Many years ago, maybe like 5 years ago, I adopted spinal navigation for my fusions, and that's a benefit to the patients, safety profile, but also benefit to me and my surgical team because less radiation, right?
Yes.
And so that's been awesome. My hospital doesn't have a robot. I'm not like a huge advocate right now of a robot. It's expensive like drill guide, but I'm excited for some of this new robotic stuff because we use the Stryker navigation, and they're coming out with the Mako spine robot, and it's just going to seamlessly integrate. So I'm excited to dabble in that.
You mentioned something that caught my attention: the expensive drill guy.
Yeah.
You're not the first person that I've heard say that.
The robot's in its infancy in spine right now. Like you said, it's just helping accurately place screws at this point. It's not something where it can do fine manipulations of surgical moves like the Da Vinci or anything like that, but there's interest within my hospital and the spine surgeons there of getting one.
So you have to there's always that politics of working with the hospitals and figuring out
Yes.
what, at the end of the day,
What they can afford
Yeah.
and what they can provide, because hospitals don't have unlimited resources.
honestly, this was fascinating. So excited for kind of what this next year looks like for you. You've explained a lot about your practice philosophy, things you're working on, things you're excited about. Where can people go to find more information about you, about your practice? Where would you point them so that we can kind of leave that, for repercussions for the market?
We've revamped our website this past year, so sciatica.com. I mean, I think that's the best place to find out about our practice and more about what we can offer for our patients.
Fantastic. Well, thanks for sitting down with us, and we hope you have a great show.
All right. Thanks a lot, buddy.
See you.